About 14 months after Siobhan Lees died following a nearly 16-hour wait in emergency, her parents are still fighting for change.
Because I never want another family to experience that. I never want someone to be that way.
They've been examining medical charts, procedures and policies to try to figure out what went wrong, doing it while grieving a devastating loss. They've kept Siobhan's room the way she left it, with all her favorite things, and her phone, where they listen to some of her voice messages.
What this one says.
Oh, you're in the shower.
Oh, you're in the shower, so her and her sister must have been having a conversation.
They brought Siobhan, who was 30, to Aberdeen Hospital last August when she wasn't feeling well, not realizing she had the life-threatening condition sepsis that's caused by the body's inflammatory response to infection. She was on a stretcher and hooked up to a cardiac monitor, but after that, it was an agonizing wait.
It was awful. My husband and I never left her side. We're strong advocates. Although, we're left with the feeling, were we strong enough, I guess, but we never left her there for the 16 hours. I was continuously asking questions and just getting blunt answers.
Her brother and sister were there too, and like their parents, were troubled by how they felt Siobhan was treated as a person with physical and mental disabilities, but still able to speak for herself. Her brother recalls medical staff talking to other family members.
It pains me to think about there's people in that emergency room or an emergency room anywhere across this province that are experiencing the same sort of treatment, and there's no advocacy there. And I just can't live with myself if I let that happen, and I could do something about that.
Nova Scotia Health completed a quality review investigation to understand what happened and find ways to improve. Its statement said, physician and operational leaders continue to meet with the family regularly to share updates, listen to their concerns, and provide answers to their questions. Several recommendations were made in the review, but the family don't know what's different today.
We know nothing brings her back, but we also know that she can be the person to create change.
They plan to keep campaigning for things like signage in emergency rooms, educating people about sepsis, in honor of their daughter they describe as fantastic. Gareth Hampshire, CBC News, Westville.
You're not going to leave him tonight, are you?